Hi everyone, my name is Maureen Green. I am a licensed therapist, and today I would like to talk to you about a specialized trauma treatment named EMDR. In my previous video, we talked about potentials for trauma, what little t and big T trauma looks like, and today I'd like to just share one of the most profound therapies I call soul surgery with you and describe its purpose and how it works. In my book, EMDR is one of the most courageous forms of therapy that one can do. I call it soul therapy. A lot of people, just taking the first step to engage in some form of therapy is courageous, but when you dive into the deeper roots of your trauma and trying to address things that you never even want to look at, that takes quite a bit of courage. EMDR stands for Eye Movement Desensitization and Reprocessing, and it was found by Francine Shapiro. I will spare you the details about how it got developed, but really the primary purpose of it is to allow the body or reprocess traumatized memories that are stuck in our body and in our brain to the point where they don't impact our daily living. The triggers that we may have based on our past traumas will then no longer be triggers in our present day. EMDR is not a talk therapy. It is a form of soul healing, I call it. And it takes quite some time for some people to prepare to be able to do this kind of work. One of the best ways to prepare is to really practice being in your body, which I will create another video just on that, to explain what that means and how many of us really at this point in our life struggle with being fully present and feeling the difficult emotions and sensations that arise without distracting, without numbing, without getting busy to avoid it. Avoidance has become the number one coping in our Western busy world. So EMDR is the opposite. Upon preparation and assessment, the actual EMDR session where reprocessing begins, people are given bilateral stimulators. Some people use light bars that basically you look at and your eyes move from left to right as you follow the light. Others use, like myself, use tactile stimulators. Basically that means you have pulsars that you hold in your hand, and I will turn them on and have you think about the traumatic memory, and they'll just buzz from one hand to the other. Sometimes people use audio stimulators, so it's a headphone that buzzes, beeps, kind of like an audiology test, some people have said. And what that does is it kind of engages both parts of our brain, the left and the right brain, and it kind of makes them talk to one another. We know that trauma is unintegrated memory, which means it's frozen in time. So when we're triggered, our reactions today are very close to how we would have responded back when the trauma occurred. And by the way, just like in the first video, this does not have to be a big T trauma of some sort of assault. This could be little T trauma that, I was the middle child and never got enough attention in my family, or I had 6 siblings who received all the attention because they were ill, and I was kind of, left alone and wanted to be perfect and not bother my family with my needs. So now I have triggers in relationships of not having my needs met. It could be a variety of different things, but the premise of it is a person will really have to be ready to go inside their body and face some of the uncomfortable experiences that on a daily basis we avoid. That's the hard part. None of us want to feel distress. Most of us want to find any way possible to avoid it. And physicians help with that, with medications. And there's nothing wrong with medications, but it's not healing. It's managing. There's other forms of therapy that have helped people to manage sort of their symptoms from the top brain to the body. Those therapies are cognitive therapies, behavioral therapies, mindfulness-based therapies, and they're wonderful to help prepare you for this kind of work, but they don't heal the roots of trauma. EMDR heals the roots of trauma. It is a courageous form of therapy that requires someone to face the things that they have not looked at for, all of their life. I call it soul surgery. We have preparation for that before people can actually begin that. And in that preparation, we expose the person to certain things to see if they can tolerate the discomfort in their body. There's an assessment. There's creating a calm, safe place that goes with trauma in case it's difficult to process. We have something that we can rely on to calm the body down if needed. And then we begin the process. And the process I do a little bit differently than we were trained to do. All the steps are the same, but I don't do short sessions. We were trained to do 1 to 2 hour sessions with most people who are showing up for any kind of trauma. And I do actually 4-hour sessions. What I learned is when people access traumatic memory in their body, whether big T or small t trauma, it's very distressing, and it creates a very visceral reaction in their body that they want to end and resolve. But with 1 or 2 hour sessions, most people don't resolve that, and they have to go home, and then they have to come back the next week or whenever they come back, while there have been now at this point opened up that sort of can of worms. I don't find that it was very helpful to people to not resolve it right away, all the way, before they left my office. A lot of them would even text me from the parking lot saying, I know it's good for me, I know I should do this, but I really don't want to come in. So I began to block off 4-hour sessions, and I wanted to make sure that I had enough time to start a traumatic memory and then complete it. And what I learned is once people actually felt the relief in their body with the completion of the original trauma, they wanted to come back and do more. They wanted to resolve everything else that was in their way. They wanted to resolve some of the present day triggers. It gave them an idea of what peace feels like. A lot of folks never felt that feeling of calm and relaxation and peace and serenity. So it's their first experience, or they have felt it, and it's kind of like giving the body some reprieve. So people are much more motivated to actually heal their trauma when they see a beginning and an end to it. And that's why I do 4-hour sessions. EMDR is probably one of the deepest forms of therapy, and one of my favorite things to do, because I get to see people go from suffering to healing within the first 4 hours of their, session with me. So I want to plant some seeds on for those of you who struggled with trauma or panic, little t or big T trauma. Really invest in that. My future video will talk about emotions and how to prepare yourself for this kind of work. If you are one that avoids being in your body, if you're one that distracts and stays busy and never really checks in below the neck what's really going on with you and doesn't try to fix it, EMDR might be a little bit premature. We might have to work on that a little bit before you're ready to fully experience the impact of your life's traumatic narrative on your physical body. Hope this was helpful. EMDR is a healing modality. It is not a management modality. I want to highlight that. With EMDR, you don't have symptoms at the end once you've completed your work, once you've completed all the trauma work. Now that might take 1 4-hour session, or it might take multiple 4-hour sessions, but once you've resolved all of the traumas in your body, you don't any longer have to manage symptoms. You may have to relearn how to behave differently, because your narrative might have been reacting to all of the trauma behaviorally as well, but physiologically your body will be calm. So it's a lot easier to do things differently, to cope differently, to speak differently when your body's not going all over the place triggering you. Please comment below, ask questions, give me some feedback if this video was helpful. Subscribe to the YouTube channel for more videos coming. Thank you so much for your time. I will talk to you next week. Take care.